Thanks very much, Emma, and good afternoon, everyone. Thank you for inviting me to speak at this important meeting. Why has the Institute asked me to give this keynote address? Looking around the room, I expect most in the audience are aged less than 40, around 40, maybe even less than 30, and live in a world which would be very foreign to me and my generation had it not been for my children dragging me along every step of the way. I assume one reason I've been invited is due to some recognition that I'm one of the few people who's worked in the area of injury and disability over virtually its whole post-Woodhouse development. So there's the longevity argument. Hands up if you have even heard of Sir Owen Woodhouse. Yeah, half, third maybe? Pretty more than I expected. I also have a manifest disability myself, and so I've lived the experience of organising care and support, the familiarity argument. Maybe people are expecting words of great technical wisdom to share. They will be disappointed. But a part of me hopes that I've been invited because I've been fairly outspoken over the years on what I see as the shortcomings in our various systems, and have done my best to help improve them, the disruptor argument. In keeping with the insights and outcomes theme of the seminar, I've also sought to consider the outcomes of our systems through the lens of the various actors: policyholders, funders, regulators, insurers, providers, advocates, and of course participants who've sustained an injury or disability. I should say at this point that I'm speaking from a purely personal perspective, and my views do not necessarily represent those of any organisation I am or have been associated with. Starting with longevity, myself and a few others in this room, or at least one that I've seen, were present at the first accident compensation seminar in May 1988, held at Wirrina, a small coastal resort south of Adelaide. This was a new world of statutory insurance, with papers on pricing, reserving, common law, structured settlements, and the new field of rehabilitation. Typically, I wrote a paper on large claims. As a side note on the Times, this was the heyday of the HIV/AIDS epidemic and public campaign, with TV ads featuring the Grim Reaper cautioning against various unsafe practices. I was on the council of the Institute at the time, and I remember the contribution of the Institute to this issue was to set up an AIDS committee, which sought to protect the life insurance industry from financial exposure against underwriting unsafe risks. I did my best to argue that perhaps we should also be looking for ways of making different and positive contributions, but at the time there was not a lot of consideration about outcomes for people at risk or having received the dreaded HIV positive notification. Just saying. In the 30 years since, we've come a long way. Prices to policyholders have for the most part reduced significantly in real terms, and both workplaces and road transport are generally safer, with reduced incidents of serious workplace and road traffic accident and death. The role of actuaries over the years has been validated and consolidated as a contributor to this stability with the now well-worn prudential governance framework of analysis, pricing, monitoring, more analysis, reserving, reporting, and back to pricing, the classic actuarial control cycle. Over the years, the sophistication of models has changed enormously, and the volume of data available has grown massively, along with the computer power to mine, interrogate, and gain insights. So at a higher level, one would say that the statutory accident comp experiment, which started 30 odd years ago, has been pretty successful from a public policy point of view. So successful was the model, in fact, that around 15 years ago, it was thought to be a good idea to apply it to other areas of social policy, starting with the development of specific lifetime care schemes for people sustaining major injuries, acknowledging that TAC and MAB had covered this for some time, and then broader disability in New South Wales Stronger Together, and extending more generally from around 2010 to fledgling New South Wales models of supply and demand linkages in social welfare, mental illness, justice, housing and homelessness, and Indigenous disadvantage. Around about the same time, the New Zealand government formalised a variant of these arrangements in the so-called investment approach to social welfare. And of course, Australia, we launched the NDIS. I'll return to the relative success of these applications and also to the outcomes of the past 30 years from the viewpoint of an injured worker or motorist. But to whet the appetite a little, consider this. Over this period, I estimate there have been somewhere around 10 million individual workplace injury claims, 2 million motor accident claims, plus public liability and medical negligence common law compensation claims. Even allowing for multiple claims by individuals, we are likely talking about several million individual people having sustained an injury significant enough to lodge a claim for treatment or compensation. Where are these millions of customers now? Did their injury recover, or are they permanently impaired? Did they return to work and stay at work? Did they continue their education? Was their health outcome sustained? Did their personal and family life suffer through the trauma of bringing a claim, which we know in many cases is a greater insult than the injury itself? Do we know anything at all about them after their last compensation payment? Did they end up on the disability support pension or other social welfare, or homeless, or in jail? And if they did, has the system been so successful after all? My suspicion is that apart from some limited and short-term durable return to work incentive schemes and the very high-end lifetime care claimants, our past customers are lost to us. And maybe that could be called success. I suspect that most people who've had an interaction with a workplace or motor injury would love to put it behind them. But I respectfully submit that in this digital world, any self-respecting retail chain, financial institution, or online media or social network knows more about the patterns, preferences and well-being of their past and present customers than do our statutory insurance schemes, which are actually set up to form a relationship and achieve an outcome for their injured participants. Unless we find the balance between protecting the system and reassuring and protecting those who the system is designed to help, we will struggle to meet the goals of this forum. So in the context of insights and outcomes, we must remember as actuaries and administrators that every number in a run-off triangle or a statistical case estimation and every injury notification and application for benefits represents a real person who has a social network, career and family of some description. Of course, there are fraudulent and exaggerated claims. And yes, there are many instances where it is more comfortable for people to receive an ongoing pension than to try to return to work. And yes, there is also a balance between the role of injury insurance in early intervention, treatment and restoration and the broader social welfare system. But rather than reinforcing these silos, let's start with the customer. We need to find the data and algorithms which identify the trends and linkages in injury pathways, penalise and expels fraudulent payments and providers, and successfully finds outcomes where people genuinely need them. This brings me to my second excuse for being here. I have a disability. Surprise, surprise. I regard myself as fortunate to have never been part of any accident compensation scheme and to have had the family support which enabled me to forge a career nevertheless. However, it is inevitable when one has a condition like mine to be exposed to the health and disability systems and to experience the emotional trauma of being different from everyone else and learning what it is like to go without things, often the most simple things in life. Over my nearly 50 years in a wheelchair, I estimate I have spent around 500 days and nights in hospital and maybe another 500 on bed rest or with a significant illness. And even a few in a nursing home when there was no pathway from hospital to home. Every morning for the past 50 years, I've needed help to get out of bed and prepare for the day, and every night the reverse. I've tried to prevent my disability from stopping me achieving my goals in life, or perhaps more importantly, from preventing my family and children from living the normal lives experienced by their peers. And still occasionally in restaurants, my wife is asked to look at the menu for me and choose what I would like to eat. So I'm very aware of the disadvantages faced by people even those, more so those without my privileges, who have sustained a severe injury or disability, particularly people who find it difficult to communicate or who have cognitive or psychosocial disabilities. The period of accident comp reform, the 1980s to the present, is exactly the same period through which the broader disability sector has grown from an institutional model to one where rights, choice and control have become part of the statutes and the vernacular. While Sir Owen Woodhouse was crafting his fundamental principles in the 60s and 70s, disability advocates around the world were campaigning for a life outside of large institutions with names like Homes for the Incurable, lunatic asylums and madhouses. 1981 was designated the International Year of Disabled People, and in the same year the ABS conducted its first survey of handicapped people, now known as the ESTAC, a Bible for any actuary working in the field. In 1984 I wrote my first sessional paper on the topic of disability, and as a young actuary I was roundly criticised for questioning the knowledge and qualifications of insurers and expert health professionals who worked in the field of disability. Nevertheless, I was supported to work outside of the system, conducting research into disability statistics and reporting. With help from more forward-looking insurers, senior actuaries and senior clinicians, I developed a longitudinal outcomes framework for people around Australia who had sustained a spinal cord injury. My vision of this so-called Australian registry was to build a database which could be a model of capturing and reporting data on both incidents of disability and ongoing wellbeing and social outcomes at the level of the individual person. Of course, funding priorities soon contracted my registry to an incident report rather than outcomes, and I had to temporarily park my grand ideas. Nevertheless, when I got the opportunity over the next 30 years, I badgered administrators of workers' comp and motor schemes to include outcome surveys as part of the data collection, mainly in vain. By the late 1980s, disability was on the road to acknowledgement, and while accident compensation statutes were being rewritten, the first National Disability Services Act was passed in 1986, and a disability agreement was forged between the Commonwealth and the states. And many people with disabilities were removed from the large institutions and provided with accommodation in so-called group homes. What is now clear to me is that these institutions were built, these initiatives were built purely on an ideology and without any prudential structure to ensure success, if you like, a control cycle. It quickly became clear that the system was underfunded. Group homes were, in many cases, just mini institutions, and there was very little investment in community support and no monitoring of outcomes. A not dissimilar situation from that emerging in aged care and well reported at present by the Royal Commission. To cut short a very long story, this situation hit the proverbial fan in the early 2000s, around about the same time as models for lifetime care and support were emerging from the Accident Compensation Prudential Framework. New South Wales initiated Stronger Together, and the shutout and dig reports were published. The productivity recommended the NDIS. Can we have the first slide, please, Fiona? These were the shutout and way forward reports. I put them up because the shutout report, black cover, is I think a good indication of the feelings and frustration of the times, which has been lost a bit these days. The second slide now, please. In my mind, the NDIS was... Second slide, good, we're there. In my mind, the NDIS was a model that could achieve the best of all worlds. I'm not going to go through these points, but I'll leave it up there for the rest of the presentation, just for a point of reference. What could go wrong with this great model? So now, let's jump to the present. In preparation for this address, I studied the annual reports of some of the accident comp schemes and also went through the program abstracts for the forum, and I thought it was fantastic. Many themes which have been around for the last 30 years are still there. Incentives to return to work, over-servicing by providers, proposals for evidence-based medicine, fraud prevention, the role of common law, and the effectiveness of step-downs in weekly payments. However, the tone of presentation of these old chestnuts has changed to use the technology and learnings available in the 21st century. The age-old problems are eliciting smarter responses. That's a good thing. As well, many themes were totally new or grown up from what I'd last seen about 10 years ago. For a start, the name of the conference has changed from a focus on compensation to injury and disability, putting the customer automatically at the centre. In addition, there are papers on topics like the customer and the community, emotional harm, perceived injustice, family approaches to workers' recovery, an interest in the lives of our customers, including the notion of a social risk assessment, and a clear recognition of the psychological consequences of serious illness or injury. All good stuff. Most pleasing for me is the continuing work on outcomes frameworks at an individual level in the NDIS and wellbeing frameworks in broader social welfare. What is still missing, however, is the routine incorporation of such individual outcome frameworks in statutory insurance models. As mentioned earlier, I've argued for decades that it would be very simple and relatively inexpensive to include in the claims management process a well-normed and simple outcomes framework, even something like the short form 12, to be recorded on all serious claimants at regular intervals and for perhaps 1 or 2 years after their last benefits have been paid. Some of the schemes are now reporting net promoter scores, and it would be interesting and easy to correlate these scores with some simple participant outcome measures. This would also give us as actuaries a powerful extra data point to use as a risk factor or predictor in models, recognising that we have known for a long time that the data which are collected, injury type, bodily location, even injury severity, are relatively poor predictors of long-term outcomes. At the risk of being kicked out of the Institute, imagine if our statutory responsibilities required us to spend as much time thinking about participant outcome modelling as we do about accounting standards or discount rates. Noting that the definition of sustainability adopted by the NDIA considers both financial sustainability and whether or not participants are receiving the support they need to achieve good life chances. And the rules of the scheme actually do require such outcomes reporting in the financial sustainability report. So in terms of collecting outcomes data and reporting, I believe we are getting there in the NDIS, and I could imagine a world in which injury schemes do collect outcomes on regularly and reported on individuals. But there is still another step. Even with perfect information, how do we translate this knowledge into implementation and outcomes? This again brings me back to the prudential governance framework. For me, the critical links are the interactions and codependencies between policy, implementation, operation monitoring and feedback to policy. In my view, much of the difficulty which has arisen in schemes like the NDIS arises from an ideology that separates policy from operations. I have at times been critical of the Institute for dipping into policy areas with little knowledge of operational realities. I think this criticism can equally be levelled at governments, which determine policy frameworks without the associated feedback loops to collect information, analyse and report on the consequence of these policies. The historical disability system is a classical example of where a good idea at the time went terribly wrong. I hope we don't repeat the same mistake. In some ways, I believe this is a natural consequence of the historical separation of, on the one hand, applied action research commissioned by corporate and statutory insurers from consultants, timely and directly related to operational issues, but usually confidential and sometimes poorly researched and constructed, compared to, on the other hand, traditional academic research, which can be comprehensive, is peer-reviewed and published in readily accessible public journals, but is often out of date by the time it is published and poorly related to operational realities. One of my great regrets, and one which I would try to remedy if I had my time again, is that I did not publish in the right places the various analyses and case studies which frame my contribution to the design of schemes like Stronger Together and the NDIS. For the most part, these were contained in bespoke and confidential reports to state and Commonwealth governments and statutory insurers. Even more frustrating is that even the highly detailed specifications in the ultimate 2011 Productivity Commission report were largely ignored in the ideology-driven policy, scheme design and legislative frameworks which followed. I feel that my frustration is shared by many of the talented operational leaders from our statutory insurance who joined the agency excited by the opportunity of the NDIS, but finding a policy world which was foreign to them. The body of academic and public literature about the NDIS and the disability system is far more prolific since its implementation than it was in the lead-up. Disappointing in that it is necessarily reporting on the outcomes of a policy approach which is not reflective of the recommendations of the original report. Another example from the Aged Care Royal Commission highlights publicly where this can lead. The continued inflow of young people into residential aged care includes a large proportion who have sustained traumatic brain injury and would have been covered by a national injury insurance scheme, one of the recommendations of the Productivity Commission. While the NDIS is now making inroads to resolve this issue, it would be interesting to analyse the extent to which it could have been mitigated by earlier implementation of the NIIS. So as a message to you guys, the next generation of young actuaries who seek to work in areas of wider fields and public policy, I would strongly recommend a different practice of highlighting our control cycle model. Identify the forums, journals and publications attended by policymakers and highlight the successes of prudential governance type models in linking directly to operational outcomes. A starting point might be the work of ANSOG, the Australian and New Zealand School of Government. Instead of discrete policy positions published in institute reports, look at wider publication of operational implementation in recognised peer-reviewed journals, tedious and costly as it is. Although there is still no guarantee of policy implementation, at least it makes specific actuarial philosophies and potential solutions more public and differentiates us from economists and data scientists. The study of implementation science or knowledge translation is becoming increasingly acknowledged as a legitimate form of study, and I believe it provides a fruitful opportunity for the control cycle framework to sit alongside or perhaps between policy developments and operational implementation. Good luck.